Well, one frustration among patients and healthcare providers as cases of COVID-19 increase is testing. ABC 6 News reporter Alice Keefe spoke with a doctor at Olmsted Medical Center today about the challenges of getting patients tested and what that could mean for the greater community.
Between midnight and 7 a.m. Friday, Dr. Jay Myers, Director of Emergency Medical Services at OMC, says 5 patients came in with mild symptoms and wanted to be tested specifically for COVID-19.
We have plenty of materials to obtain samples. The limitation is actually the ability to test those samples.
But it's not as simple as swabbing a nose, a mouth, and sending those specimens to the Minnesota Department of Health's lab in the Twin Cities.
We can obtain the samples at any location, but the tests are only being run at the state level. So they have to be sent out, and we have to get permission from the state or give them the story for them to say that they'll accept the samples for testing.
Unless you've traveled somewhere there's known activity of the virus, or you've come in direct contact with someone who's gotten the virus, or you're so sick you need to be hospitalized, you probably won't be tested.
The limitation right now is the state that everybody has a limited number of tests that they can perform, so they're being very judicial in who they're doing the test on.
But as more cases pop up,
in a way we've been a little bit behind all across the board, and as I was mentioning earlier, we were asking about China when it was already in other countries, and then we ask about those countries when it's already in another country, and then we're asking about another country when it's already in Washington, and then we're asking about Washington when it's already in New York and we don't know about it. And I think now with the cases that we've had positive in Minnesota, I think most of us are realizing that we're probably at a point where it's in the community.
Testing identifies who's infected, but since there's no treatment, Myers says the best thing to do if you're not feeling well is to stay home so you don't get more people sick.
If they're having minimal symptoms, just cold symptoms, they don't feel that they need to be in the hospital, or they're not severely ill, we're asking them to call their primary provider. We're asking them to call any of the hotlines. The general concept for testing is that we want to do testing in as remote locations as possible, because the big goal with all of this is try to slow down the spread of the disease as much as possible.
In Rochester, Alice Keefe, ABC 6 News.